Question 1. A nurse is caring for a client with a new diagnosis of heart failure. Which teaching points should the nurse include regarding lifestyle modifications? Select all that apply. A. Restrict fluid intake to 500 milliliters per day. B. Engage in moderate intensity exercise most days of the week. C. Limit sodium intake to 2 to 3 grams per day. D. Monitor daily weight and report a gain of 3 to 5 pounds in a week. E. Avoid all alcohol consumption. F. Obtain an annual influenza vaccine. Answer. Engage in moderate intensity exercise most days of the week. Limit sodium intake to 2 to 3 grams per day. Monitor daily weight and report a gain of 3 to 5 pounds in a week. Obtain an annual influenza vaccine. This question tests knowledge of essential lifestyle modifications for managing heart failure. Keywords are heart failure and lifestyle modifications. Clients with heart failure should engage in regular moderate exercise as tolerated, restrict sodium intake to 2 to 3 grams daily to prevent fluid retention, monitor daily weight closely and report significant gains, like 3 to 5 pounds in a week, which indicate fluid accumulation, and receive annual influenza vaccinations to prevent respiratory infections that can exacerbate heart failure. For instance, explaining that controlling salt intake helps prevent swelling in the legs and lungs can make this restriction more understandable. Always remember that comprehensive client education is key to effective chronic disease management. Question 2. The nurse is assessing a client admitted with diabetic ketoacidosis, DK. Which clinical manifestations would the nurse expect to find? Select all that apply. A. Kussmaul respirations. B. Bradycardia. C. Fruity breath odor. D. Hypertension. E. Hypoglycemia. F. Polyuria. Answer. Kussmaul respirations, fruity breath odor, polyuria. This question assesses the nurse's understanding of the classic signs of diabetic ketoacidosis, DK. The clue is diabetic ketoacidosis, DK. In DKA, the body produces ketones, leading to metabolic acidosis, which manifests as Kussmaul respirations, deep, rapid breathing to blow off CO2, and a fruity breath odor due to acetone. High blood glucose also causes osmotic diuresis, leading to polyuria, frequent urination. For example, a client breathing deeply and rapidly with a sweet, acetone smell on their breath and reporting increased urination is likely experiencing DKA. Remember that DKA is a serious complication of diabetes requiring immediate attention. Question 3. A client is receiving total parenteral nutrition, TPN, via a central venous catheter. Which nursing interventions are appropriate for this client? Select all that apply. A. Change the TPN bag and tubing every 48 hours. B. Monitor blood glucose levels every 4 to 6 hours. C. Assess for signs of infection at the insertion site. D. Administer insulin subcutaneously as ordered for hyperglycemia. E. Discontinue TPN immediately if the client develops a fever. F. Flush the catheter with heparin daily when not in use. Answer. Monitor blood glucose levels every 4 to 6 hours, assess for signs of infection at the insertion site, administer insulin subcutaneously as ordered for hyperglycemia, flush the catheter with heparin daily when not in use. This question tests the nurse's understanding of essential care for clients receiving total parenteral nutrition, TPN. Keywords are total parenteral nutrition, TPN, and central venous catheter. Due to the high glucose content, monitoring blood glucose every 4 to 6 hours is crucial to detect hyperglycemia, and insulin may be needed. Central lines are a portal for infection, so daily assessment of the insertion site is vital. When not actively infusing TPN, the central line must be flushed regularly, often with heparin, to maintain patency. For instance, observing redness or tenderness at the catheter site or noting elevated blood glucose levels requires prompt nursing action. Always remember that TPN carries risks of metabolic complications and infection, requiring vigilant monitoring. Question 4. A client has just undergone a complete thyroidectomy. The nurse should be vigilant for which potential complications in the immediate postoperative period? Select all that apply. A. Hypocalcemia. B. Laryngeal nerve damage. C. Thyroid storm. D. Hemorrhage. E. Respiratory distress. F. Hypoglycemia. Answer. Hypocalcemia, laryngeal nerve damage, hemorrhage, respiratory distress. This question addresses the critical postoperative complications following a complete thyroidectomy. The clue is complete thyroidectomy in the immediate postoperative period. Removing the thyroid gland risks accidental removal or damage to the parathyroid glands, leading to hypocalcemia. The recurrent laryngeal nerve is close to the thyroid, so nerve damage affecting voice and breathing is a concern. The highly vascular nature of the thyroid gland makes hemorrhage a significant risk, which can lead to airway compression and respiratory distress. For example, a client exhibiting tingling around the mouth, a sign of hypocalcemia, or hoarseness, suggesting laryngeal nerve damage, requires immediate evaluation. Always remember that airway management and monitoring for tetany are paramount after thyroid surgery. Question 5. A nurse is educating a client about managing symptoms of gastroesophageal reflux disease, GERD. Which statements indicate the client understands the teaching? Select all that apply. A. I will avoid eating large meals before bedtime. B. I will elevate the head of my bed by 6 to 8 inches. C. I should drink coffee and citrus juices regularly. D. I will try to lose weight if I am overweight. E. I should wear tight clothing around my waist. F. I will take my antacids after meals and at bedtime. Answer. I will avoid eating large meals before bedtime. I will elevate the head of my bed by 6 to 8 inches. I will try to lose weight if I am overweight. I will take my antacids after meals and at bedtime. This question evaluates the client's understanding of managing gastroesophageal reflux disease, GERD, symptoms. The clue is managing symptoms of gastroesophageal reflux disease, GERD. Avoiding large meals before bedtime, elevating the head of the bed, losing weight if overweight, and taking antacids after meals and at bedtime are all effective strategies to reduce acid reflux and its symptoms. For example, raising the head of the bed uses gravity to keep stomach acid from flowing back into the esophagus during sleep. It's important to remember that lifestyle modifications are the first line of defense against GERD. Question 6. A client with a new colostomy expresses anxiety about managing their stoma. Which nursing interventions are appropriate to address the client's concerns? Select all that apply. A. Provide written materials and diagrams about stoma care. B. Encourage the client to verbalize fears and feelings about the colostomy. C. Demonstrate pouching techniques and allow the client to practice with supervision. D. Suggest that the client avoid looking at the stoma until they are more comfortable. E. Refer the client to a local ostomy support group. F. Inform the client that all anxiety is normal and will eventually pass. Answer. Provide written materials and diagrams about stoma care. encourage the client to verbalize fears and feelings about the colostomy, demonstrate pouching techniques and allow the client to practice with supervision, refer the client to a local ostomy support group. This question tests the nurse's ability to provide comprehensive support and education for a client with a new colostomy experiencing anxiety. The keywords are new colostomy and anxiety. Providing educational materials, allowing the client to express emotions, offering hands-on demonstration and practice of stoma care, and referring to support groups are all effective ways to empower the client and reduce anxiety. For instance, physically practicing changing the pouch with the nurse's guidance can build confidence and reduce fear of leakage or odor. Remember that promoting self-care and offering emotional support are crucial for adaptation to a colostomy. Question 7. A nurse is caring for a client with active pulmonary tuberculosis. Which actions are essential for preventing the transmission of the disease? Select all that apply. A. Place the client in a private room with negative air pressure. B. Ensure the client wears a surgical mask when leaving the room. C. Wear an N95 respirator mask when providing direct client care. D. Encourage family visitors to wear surgical masks. E. Administer prophylactic antibiotics to all healthcare workers. F. Provide the client with tissues and a closed container for disposal. Answer. Place the client in a private room with negative air pressure. Ensure the client wears a surgical mask when leaving the room. Wear an N95 respirator mask when providing direct client care. Provide the client with tissues and a closed container for disposal. This question focuses on the crucial infection control measures for pulmonary tuberculosis. TB. The clue is active pulmonary tuberculosis. Placing the client in a negative air pressure room, ensuring they wear a surgical mask when outside the room, and healthcare workers wearing an N95 respirator are standard airborne precautions. Providing tissues and a closed container helps contain respiratory secretions. For example, wearing an N95 mask protects the healthcare provider from inhaling airborne droplets containing the bacteria. Remember that strict adherence to airborne precautions is paramount in preventing TB transmission. Question 8. The nurse is assessing a client suspected of having a urinary tract infection, UTI. Which findings would support this suspicion? Select all that apply. A. Dysuria. B. Flank pain. C. Urine-specific gravity of 1,005. D. Urinary frequency. E. Hematuria. F. Hypotension. Answer. Dysuria, flank pain, urinary frequency, hematuria. This question addresses the common clinical manifestations of a urinary tract infection, UTI. The clue is suspected of having a urinary tract infection, UTI. Dysuria, painful urination, increased urinary frequency, and hematuria, blood in the urine, are classic lower UTI symptoms. Flank pain suggests a possible upper UTI or pyelonephritis, kidney infection. For example, a client complaining of a burning sensation during urination and needing to go to the bathroom much more often than usual is exhibiting common UTI signs. Early recognition and treatment of UTIs are important to prevent complications. Question 9. A nurse is preparing to administer an opioid analgesic to a client post-surgery. Which assessments are crucial before administering the medication? Select all that apply. A. Client's pain level. B. Last bowel movement. C. Client's respiratory rate. D. Level of consciousness. E. Client's blood pressure. F. Presence of nausea. Answer. Client's pain level, client's respiratory rate, level of consciousness, client's blood pressure, presence of nausea. This question tests the nurse's priority assessments before administering an opioid analgesic. The keywords are opioid analgesic and post-surgery. Assessing the client's current pain level is essential to determine the need for medication and its effectiveness. Opioids can cause respiratory depression, sedation, level of consciousness, hypotension, blood pressure, and nausea, so these assessments are critical for client safety. For instance, a client with a respiratory rate below 12 breaths per minute might be too sedated, indicating a need to hold the medication or administer a lower dose. Always remember to prioritize safety and assess for potential adverse effects before giving opioids. Question 10. A nurse is providing discharge teaching to a client with a new prescription for warfarin. Which statements should the nurse include in the teaching? Select all that apply. A. You should avoid foods high in vitamin K, such as leafy green vegetables. B. Report any signs of unusual bleeding, such as nosebleeds or blood in your urine, to your provider. C. You must have regular blood tests to monitor your INR. D. It's safe to take over-the-counter pain relievers like ibuprofen while on warfarin. E. Keep your appointments for follow-up laboratory work as scheduled. F. Warfarin starts working immediately, so you'll be fully protected right away. Answer. You should avoid foods high in vitamin K, such as leafy green vegetables. Report any signs of unusual bleeding, such as nosebleeds or blood in your urine, to your provider. You must have regular blood tests to monitor your INR. Keep your appointments for follow-up laboratory work as scheduled. This question focuses on essential client education for warfarin therapy. The clue is new prescription for warfarin. Clients should be taught to limit foods high in vitamin K, which can counteract warfarin's effects, and to report any signs of bleeding, which is a major adverse effect. Regular INR monitoring is critical to ensure the medication is within a therapeutic range, and clients must adhere to their lab appointments. For example, a client who starts eating large amounts of spinach daily might see their INR drop, increasing their risk of clotting. It's crucial to reinforce that consistent intake of vitamin K and diligent monitoring are vital for safe warfarin use. Question 11. The nurse is caring for a client diagnosed with Clostridium difficile, C. difficile, infection. Which infection control measures should the nurse implement? Select all that apply. A. Place the client in a private room. B. Wear gloves and a gown when entering the client's room. C. Use an alcohol-based hand sanitizer after removing gloves. D. Dedicate equipment, e.g., stethoscope, blood pressure cuff, to the client's room. E. Ensure proper cleaning of environmental surfaces with a bleach-based solution. F. Encourage visitors to wear a surgical mask. Answer. Place the client in a private room, wear gloves and a gown when entering the client's room, dedicate equipment, e.g., stethoscope, blood pressure cuff, to the client's room, ensure proper cleaning of environmental surfaces with a bleach-based solution. This question tests knowledge of crucial infection control for Clostridium difficile, C. difficile. The clue is Clostridium difficile, C. difficile, infection. C. diff is highly contagious and spread via spores, requiring contact precautions, a private room, wearing gloves and a gown, and using dedicated equipment to prevent cross-contamination. Alcohol-based hand sanitizers are ineffective against C. diff spores, so soap and water hand washing is essential, and bleach-based solutions are needed for environmental cleaning. For example, having a dedicated blood pressure cuff for the client prevents spores from being carried to other clients. Remember that thorough hand washing with soap and water is paramount for C. diff. Question 12. A client is admitted with symptoms suggestive of a ruptured appendix. Which clinical findings would the nurse anticipate? Select all that apply. A. Rebound tenderness in the right lower quadrant. B. Diarrhea. C. Nausea and vomiting. D. Low-grade fever. E. Bradycardia. F. Absent bowel sounds. Answer. Rebound tenderness in the right lower quadrant, nausea and vomiting, low-grade fever, absent bowel sounds. This question assesses the nurse's understanding of the expected findings in a client with a ruptured appendix. The clue is ruptured appendix. A ruptured appendix leads to peritonitis, causing severe right lower quadrant pain with rebound tenderness, nausea, vomiting, and a low-grade fever. Peritonitis can also cause paralytic ileus, resulting in absent bowel sounds. For instance, a client with sudden, severe abdominal pain that worsens when pressure is released, accompanied by nausea and absent bowel sounds, likely has peritonitis. Recognizing these signs is crucial for prompt surgical intervention. Question 13. A nurse is caring for a client who is actively seizing. Which interventions are appropriate during the seizure? Select all that apply. A. Restrain the client's limbs to prevent injury. B. Loosen tight clothing around the client's neck. C. Protect the client's head with a pillow or blanket. D. Insert a tongue blade to prevent the client from biting their tongue. E. Turn the client to their side. F. Document the duration and characteristics of the seizure. Answer. Loosen tight clothing around the client's neck. Protect the client's head with a pillow or blanket. Turn the client to their side. Document the duration and characteristics of the seizure. This question addresses the priority nursing actions during an active seizure. The keyword is actively seizing. The primary goals are to ensure client safety and maintain a patent airway, so loosening clothing around the neck, protecting the head, and turning the client to their side are crucial. Observing and documenting the seizure's characteristics and duration provides vital information for diagnosis and treatment. For example, positioning the client on their side helps prevent aspiration of vomit or secretions, which is a major risk during a seizure. Remember that never attempting to restrain a seizing client or insert anything into their mouth is vital for their safety. Question 14. A nurse is providing care for a client receiving continuous bladder irrigation, CBI, after a transurethral resection of the prostate, TURP. Which observations require immediate nursing intervention? Select all that apply. A. Clear, pink-tinged urine in the drainage bag. B. Client reports continuous bladder spasms. C. Bright red urine with numerous clots. D. Irrigation fluid intake significantly greater than urine output. E. Client's abdominal distension and discomfort. F. Drainage bag is emptying properly. Answer. Client reports continuous bladder spasms, bright red urine with numerous clots, irrigation fluid intake significantly greater than urine output, client's abdominal distension and discomfort. This question tests the nurse's ability to identify complications in a client receiving continuous bladder irrigation, CBI, after a TURP. The clues are continuous bladder irrigation, CBI, and transurethral resection of the prostate, TURP. Continuous bladder spasms can indicate a need for antispasmodic medication or catheter adjustment. Bright red urine with numerous clots signals active bleeding and requires intervention. When irrigation fluid intake exceeds urine output significantly, it suggests an obstruction, potentially leading to bladder distension, discomfort, and fluid absorption. For example, if the client's abdomen is becoming distended and they are in pain, the catheter might be blocked, requiring manual irrigation to clear clots. Always remember to assess patency and bleeding closely with CBI. Question 15. A nurse is conducting discharge teaching for a client with newly diagnosed celiac disease. Which foods should the nurse instruct the client to avoid? Select all that apply. A. Wheat bread. B. Oats, unless certified gluten-free. C. Barley soup. D. Rice cakes. E. Rye crackers. F. Corn tortillas. Answer. Wheat bread, oats, unless certified gluten-free, barley soup, rye crackers. This question assesses the nurse's understanding of dietary restrictions for celiac disease. The clue is newly diagnosed celiac disease. Celiac disease requires strict avoidance of gluten, which is found in wheat, barley, rye, and cross-contaminated oats. Wheat bread, barley soup, rye crackers, and non-certified oats all contain gluten and must be avoided. For instance, explaining that even small amounts of gluten can trigger intestinal damage helps clients understand the importance of avoiding these foods. Remember that reading food labels carefully for hidden gluten is crucial for managing celiac disease. Question 16. A client in the emergency department exhibits signs of an acute asthma exacerbation. Which clinical manifestations would the nurse expect to find? Select all that apply. A. Wheezing on expiration. B. Bradypnea. C. Use of accessory muscles for breathing. D. Cyanosis. E. Paradoxical pulse. F. Productive cough. Answer. Wheezing on expiration, use of accessory muscles for breathing, cyanosis, paradoxical pulse. This question tests the nurse's recognition of the signs of an acute asthma exacerbation. The clue is acute asthma exacerbation. During an exacerbation, the airways narrow, causing wheezing, especially on expiration, and increased effort to breathe, leading to the use of accessory muscles. Severe exacerbations can cause hypoxemia, resulting in cyanosis, and sometimes a paradoxical pulse, a drop in systolic blood pressure during inspiration. For example, a client struggling to breathe, with visible neck muscle use and blue-tinged lips, needs immediate intervention. Always remember that worsening signs like diminished breath sounds, even without wheezing, can indicate a severe, life-threatening attack. Question 17. A nurse is caring for a client with a full-thickness burn injury. Which interventions are appropriate for this client? Select all that apply. A. Administer analgesics as prescribed for pain. B. Apply topical antimicrobial agents to the burn wound. C. Encourage a high-protein, high-calorie diet. D. Provide passive range of motion exercises. E. Change dressings using sterile technique. F. Initiate intravenous fluids rapidly. Answer. Administer analgesics as prescribed for pain, apply topical antimicrobial agents to the burn wound, encourage a high-protein, high-calorie diet, change dressings using sterile technique, initiate intravenous fluids rapidly. This question focuses on essential nursing care for a client with a full-thickness burn injury. The keywords are full-thickness burn injury. Pain management is paramount, and topical antimicrobials prevent infection. Burns significantly increase metabolic demands, necessitating a high-protein, high-calorie diet for healing. Dressings must be changed using sterile technique to prevent infection, and rapid intravenous fluid resuscitation is critical to prevent hypovolemic shock. For example, ensuring the client has adequate pain control before a dressing change will make the procedure more tolerable and encourage participation. Remember that meticulous wound care, pain management, and nutritional support are crucial in burn care. Question 18. The nurse is conducting a focused neurological assessment on a client experiencing a potential stroke. Which findings are indicative of a stroke? Select all that apply. A. Sudden onset of unilateral weakness. B. Slurred speech, dysarthria. C. Acute confusion or altered mental status. D. Bilateral tingling in the extremities. E. Facial drooping on one side. F. Sudden severe headache. Answer. Sudden onset of unilateral weakness, slurred speech, dysarthria, acute confusion or altered mental status, facial drooping on one side, sudden severe headache. This question tests the nurse's ability to recognize the classic signs and symptoms of a stroke. The clues are focused neurological assessment and potential stroke. Strokes typically present with sudden, unilateral symptoms like weakness, hemiparesis, facial drooping, and speech disturbances such as dysarthria, slurred speech, or aphasia. Acute confusion or altered mental status and a sudden severe headache, especially if the worst headache of my life, are also common. For example, if a client suddenly can't lift their left arm and the left side of their face droops when they try to smile, these are strong indicators of a stroke. Timely recognition and immediate intervention are critical in improving stroke outcomes. Question 19. A nurse is caring for a client with acute kidney injury, AKI. Which laboratory findings would the nurse expect to see? Select all that apply. A. Elevated serum creatinine. B. Decreased blood urea nitrogen, BUN. C. Hyperkalemia. D. Metabolic acidosis. E. Hypophosphatemia. F. Decreased glomerular filtration rate, GFR. Answer. Elevated serum creatinine, hyperkalemia, metabolic acidosis, decreased glomerular filtration rate, GFR. This question assesses the nurse's understanding of the expected laboratory changes in acute kidney injury, AKI. The clue is acute kidney injury, AKI. AKI leads to a buildup of waste products, causing elevated serum creatinine and blood urea nitrogen, BUN, not decreased D. The kidneys also regulate electrolytes and acid-base balance, so hyperkalemia, high potassium, and metabolic acidosis are common. A primary indicator of impaired kidney function is a decreased glomerular filtration rate, GFR. For instance, a client with a creatinine level of 4, 0 mg/dl, normal 0, 6-1, 2 mg/dl, and a GFR below 60 ml/min/1, 73 m2 suggests significant kidney impairment. Remember that these lab values reflect the kidney's inability to filter waste and maintain homeostasis. Question 20. A client with chronic obstructive pulmonary disease, COD, is being discharged. Which instructions should the nurse include in the discharge teaching? Select all that apply. A. Avoid large crowds and sick individuals. B. Perform pursed lip breathing exercises regularly. C. Increase fluid intake to thin respiratory secretions. D. Report increased shortness of breath or changes in sputum color. E. Get vaccinated for influenza and pneumonia. F. Use oxygen at 6 liters per minute via nasal cannula at all times. Answer. Avoid large crowds and sick individuals, perform pursed lip breathing exercises regularly, increase fluid intake to thin respiratory secretions, report increased shortness of breath or changes in sputum color, get vaccinated for influenza and pneumonia. This question tests the nurse's knowledge of comprehensive discharge teaching for clients with chronic obstructive pulmonary disease, COD. The clue is chronic obstructive pulmonary disease, COPD. Avoiding illness, practicing pursed lip breathing to improve gas exchange, increasing fluid intake to mobilize secretions, and promptly reporting worsening symptoms or infection signs are crucial for managing COPD exacerbations. Vaccinations for influenza and pneumonia are vital to prevent severe respiratory infections. For example, teaching a client to breathe out slowly through pursed lips helps them expel more trapped air, improving ventilation. It's important to remember that education empowers clients to manage their chronic condition effectively. Question 21. A nurse is assessing a client admitted with fluid volume deficit. Which clinical manifestations would the nurse expect to find? Select all that apply. A. Bounding pulse. B. Increased urine-specific gravity. C. Dry mucous membranes. D. Peripheral edema. E. Decreased blood pressure. F. Distended neck veins. Answer. Increased urine-specific gravity, dry mucous membranes, decreased blood pressure. This question tests the nurse's ability to identify signs of fluid volume deficit, dehydration. The keyword is fluid volume deficit. When dehydrated, the body tries to conserve fluid, leading to concentrated urine with an increased specific gravity. Mucous membranes become dry due to lack of hydration, and blood pressure decreases because of reduced circulating blood volume. For instance, a client with cracked lips, very concentrated urine, and who reports feeling dizzy when standing up is showing clear signs of dehydration. Remember that assessing skin turgor and capillary refill are also important indicators. Question 22. A client is prescribed digoxin. Which parameters should the nurse assess before administering the medication? Select all that apply. A. Apical pulse rate. B. Blood pressure. C. Potassium level. D. Respiratory rate. E. INR. F. Urine output. Answer. Apical pulse rate, potassium level. This question assesses the critical nursing considerations before administering digoxin. The keyword is digoxin. Digoxin affects cardiac contractility and heart rate, so the apical pulse must be assessed for 1 full minute. If it's below 60 bpm, the medication should typically be held. Hypokalemia, low potassium, significantly increases the risk of digoxin toxicity, so monitoring potassium levels is crucial. For example, if a client's apical pulse is 52 bpm, administering digoxin could cause a dangerous bradycardia. Always remember that digoxin has a narrow therapeutic range, and careful monitoring is essential for safety. Question 23. A nurse is providing education to a client prescribed a new medication, sublingual nitroglycerin, for angina. Which instructions should the nurse include? Select all that apply. A. Take 1 tablet every 5 minutes until pain subsides, up to 3 doses. B. Store the medication in a cool, dark place, in its original container. C. If pain is not relieved after 1 tablet, call 911 immediately. D. You can swallow the tablet with a sip of water if it doesn't dissolve quickly. E. Expect a tingling sensation under your tongue when the medication is working. F. Replace the medication every 3 to 6 months, even if the bottle is not empty. Answer. Take 1 tablet every 5 minutes until pain subsides, up to 3 doses. Store the medication in a cool, dark place, in its original container. Expect a tingling sensation under your tongue when the medication is working. Replace the medication every 3 to 6 months, even if the bottle is not empty. This question tests essential client education for sublingual nitroglycerin for angina. The clues are sublingual nitroglycerin and angina. Clients should be taught to take one tablet every 5 minutes for up to 3 doses, store it correctly to maintain potency, expect a tingling sensation, indicating potency, and replace the bottle every 3 to 6 months regardless of remaining tablets. If pain is not relieved after the first dose, or if it worsens, they should call 911. For example, if a client experiences chest pain, they should place one tablet under their tongue. If after 5 minutes the pain is still present, they take a second and then call emergency services if it persists after a total of 3 doses over 15 minutes. It's crucial for clients to understand the proper use and storage to ensure the medication's effectiveness in an emergency. Question 24. A nurse is assessing a client for signs of increased intracranial pressure, ICP. Which findings would indicate a rise in ICP? Select all that apply. A. Pupillary changes, e.g., sluggish reaction, unequal size. B. Bradycardia. C. Hypertension with a widening pulse pressure. D. Vomiting without nausea, projectile vomiting. E. Decreased level of consciousness. F. Tachycardia. Answer. Pupillary changes, e.g., sluggish reaction, unequal size, bradycardia, hypertension with a widening pulse pressure, vomiting without nausea, projectile vomiting, decreased level of consciousness. This question assesses the nurse's ability to identify clinical manifestations of increased intracranial pressure, ICP. The clue is increased intracranial pressure, ICP. Key indicators include changes in pupillary response, such as sluggishness or inequality, a decreased level of consciousness, the earliest sign, projectile vomiting without nausea, and changes in vital signs known as Cushing's triad, bradycardia, hypertension with a widening pulse pressure. For example, a client who suddenly becomes lethargic, has one pupil larger than the other, and a blood pressure of 180/60 mmHg, a wide pulse pressure, suggests rising ICP. Recognizing these signs quickly is critical for preventing permanent neurological damage. Question 25. A nurse is caring for a client with a nasogastric, NG, tube inserted for gastric decompression. Which nursing interventions are appropriate for this client? Select all that apply. A. Assess placement of the NG tube before each use or every 4 to 8 hours. B. Irrigate the NG tube with 30 ml of normal saline every 4 hours or as needed. C. Monitor the client's intake and output. D. Provide frequent oral hygiene. E. Assess for signs of abdominal distension and nausea. F. Elevate the head of the bed to at least 30 degrees. Answer. Assess placement of the NG tube before each use or every 4 to 8 hours. Irrigate the NG tube with 30 ml of normal saline every 4 hours or as needed. Monitor the client's intake and output. Provide frequent oral hygiene. Assess for signs of abdominal distension and nausea. Elevate the head of the bed to at least 30 degrees. This question addresses the comprehensive nursing care for a client with a nasogastric, NG, tube for gastric decompression. The clues are nasogastric, NG, tube and gastric decompression. All listed options are appropriate interventions to ensure tube patency, prevent complications, and promote client comfort and safety. Regular assessment of placement, irrigation to prevent clogging, strict intake and output monitoring to assess fluid balance, frequent oral hygiene for comfort, monitoring for abdominal distension/nausea to assess decompression effectiveness, and elevating the head of the bed to prevent aspiration are all critical. For example, if the client complains of nausea or abdominal fullness, the nurse should first check NG tube patency and position. Always remember that meticulous NG tube care prevents complications and promotes client well-being. Question 26. The nurse is preparing to administer a blood transfusion. Which actions are essential before initiating the transfusion? Select all that apply. A. Verify the client's identity with 2 identifiers. B. Obtain baseline vital signs. C. Administer an antihistamine prophylactically. D. Confirm blood product type and cross-match with another licensed nurse. E. Ensure a patent intravenous access line with a 22-gauge or larger catheter. F. Have epinephrine readily available at the bedside. Answer. Verify the client's identity with 2 identifiers, obtain baseline vital signs, confirm blood product type and cross-match with another licensed nurse, ensure a patent intravenous access line with a 22-gauge or larger catheter. This question tests the crucial steps for safe blood transfusion administration. The keyword is blood transfusion. Verifying client identity, obtaining baseline vital signs, and having a second licensed nurse confirm the blood product against client data are non-negotiable safety checks. Ensuring a patent for access, preferably with a larger gauge catheter, 18-20 gauge is ideal, but 22 gauge is acceptable for slower rates, is necessary for transfusion. For instance, correctly matching the blood product to the client's wristband, verifying with a second nurse, prevents potentially fatal transfusion reactions. Remember that following these meticulous steps is vital to client safety during blood transfusions. Question 27. A nurse is assessing a client with diverticulitis. Which findings would the nurse anticipate? Select all that apply. A. Left lower quadrant pain. B. Right upper quadrant pain. C. Fever. D. Constipation. E. Rebound tenderness. F. Diarrhea. Answer. Left lower quadrant pain, fever, constipation, rebound tenderness. This question assesses the nurse's knowledge of the typical manifestations of diverticulitis. The keyword is diverticulitis. Diverticulitis often presents with abdominal pain, typically in the left lower quadrant, as this is where most diverticula are found. Inflammation can lead to fever, and changes in bowel habits like constipation are common. Rebound tenderness can indicate peritoneal irritation. For example, a client complaining of localized pain in their lower left abdomen, accompanied by a low-grade fever, strongly suggests diverticulitis. Recognizing these signs helps in prompt diagnosis and management. Question 28. A client is receiving chemotherapy and develops stomatitis. Which nursing interventions are appropriate to manage this complication? Select all that apply. A. Encourage consumption of spicy or acidic foods. B. Provide frequent oral hygiene with a soft toothbrush. C. Administer viscous lidocaine gargle before meals. D. Recommend a bland, soft diet. E. Offer sips of warm saline mouthwash. F. Encourage the use of alcohol-based mouthwashes. Answer. Provide frequent oral hygiene with a soft toothbrush, administer viscous lidocaine gargle before meals, recommend a bland, soft diet, offer sips of warm saline mouthwash. This question focuses on appropriate nursing interventions for clients experiencing stomatitis due to chemotherapy. The clue is chemotherapy and stomatitis. Stomatitis is painful inflammation of the mouth, so providing gentle oral hygiene with a soft toothbrush, using pain-relieving gargles like viscous lidocaine before meals, offering a bland, soft diet, and rinsing with warm saline mouthwash are all effective. For example, a client with mouth sores may find it easier to eat mashed potatoes or scrambled eggs after using a pain-relieving rinse. Avoiding irritating foods and alcohol-based mouthwashes is also important. Question 29. The nurse is educating a client with chronic kidney disease about dietary management. Which dietary recommendations should the nurse include? Select all that apply. A. Limit protein intake. B. Restrict sodium intake. C. Increase phosphorus intake. D. Limit potassium-rich foods. E. Increase fluid intake. F. Choose high-quality protein sources. Answer. Limit protein intake, restrict sodium intake, limit potassium-rich foods, choose high-quality protein sources. This question addresses dietary management for clients with chronic kidney disease, CKD. The clue is chronic kidney disease. Clients with CKD need to limit protein intake to reduce metabolic waste products, restrict sodium to manage fluid retention and blood pressure, and limit potassium-rich foods to prevent hyperkalemia. However, the protein consumed should be high quality, e.g., from eggs, lean meat, to ensure essential amino acids are met. For example, a client might be advised to avoid processed foods high in sodium and to choose egg whites over whole eggs to limit phosphorus. Remember that individualized dietary counseling from a dietitian is often beneficial for these complex needs. Question 30. A nurse is assessing a client who has just undergone a cardiac catheterization via the femoral artery. Which post-procedure findings require immediate intervention? Select all that apply. A. Pedal pulse diminished compared to baseline. B. Hematoma at the insertion site. C. Client reports numbness and tingling in the affected leg. D. Bleeding at the insertion site. E. Capillary refill in affected leg greater than 3 seconds. F. Client reports mild discomfort at the insertion site. Answer. Pedal pulse diminished compared to baseline, hematoma at the insertion site, client reports numbness and tingling in the affected leg, bleeding at the insertion site, capillary refill in affected leg greater than 3 seconds. This question identifies critical post-cardiac catheterization complications via the femoral artery. The keywords are cardiac catheterization via the femoral artery and immediate intervention. A diminished pedal pulse, hematoma, numbness/tingling, active bleeding, and delayed capillary refill all indicate potential arterial occlusion or hemorrhage requiring urgent nursing action. For example, a client with a palpable, expanding lump at the groin that is actively oozing blood needs immediate pressure application and notification of the provider. These signs suggest compromised circulation or hemorrhage, which are serious complications. Question 31. A nurse is caring for a client with a history of seizures. Which measures should the nurse implement for seizure precautions? Select all that apply. A. Ensure suction equipment is readily available at the bedside. B. Pad the side rails of the bed. C. Keep the client in a supine position at all times. D. Insert an oral airway proactively to maintain patency. E. Loosen restrictive clothing around the client's neck. F. Keep the bed in the lowest position. Answer. Ensure suction equipment is readily available at the bedside, pad the side rails of the bed, loosen restrictive clothing around the client's neck, keep the bed in the lowest position. This question addresses appropriate seizure precautions for a client with a history of seizures. The keyword is seizure precautions. Having suction equipment ready prevents aspiration, padding side rails protects against injury, loosening clothing ensures an open airway, and keeping the bed low reduces injury risk if the client falls out. For example, if a client begins to seize, the nurse can immediately turn them to their side and use suction if needed. Prophylactically inserting an oral airway or maintaining a supine position are not standard and can cause harm during a seizure. Question 32. The nurse is teaching a client about self-management of type 1 diabetes. Which statements indicate an understanding of the teaching? Select all that apply. A. I will check my blood sugar levels before meals and at bedtime. B. If I feel shaky, sweaty, and confused, I should eat a complex carbohydrate first. C. I need to rotate injection sites to prevent lipodystrophy. D. I will avoid all carbohydrates in my diet. E. I should always carry a source of fast-acting carbohydrate with me. F. I can skip my insulin dose if I don't eat much for a meal. Answer. I will check my blood sugar levels before meals and at bedtime. I need to rotate injection sites to prevent lipodystrophy. I should always carry a source of fast-acting carbohydrate with me. This question evaluates a client's understanding of essential self-management strategies for type 1 diabetes. The clue is self-management of type 1 diabetes. Regular blood glucose monitoring, rotating insulin injection sites to prevent fatty tissue changes, lipodystrophy, and carrying a fast-acting carbohydrate for hypoglycemia are all vital. For instance, if a client suddenly feels dizzy and sweaty, consuming orange juice can rapidly raise blood sugar to treat hypoglycemia. Skipping insulin doses or avoiding all carbohydrates is dangerous and incorrect. Question 33. A nurse is providing care for a client receiving chemotherapy who is experiencing neutropenia. Which interventions are essential for preventing infection? Select all that apply. A. Place the client in a private room. B. Encourage frequent hand hygiene for the client and all visitors. C. Provide fresh fruits and vegetables with every meal. D. Monitor temperature every 4 hours. E. Avoid invasive procedures, e.g., injections, catheterization, when possible. F. Administer broad-spectrum antibiotics prophylactically. Answer. Place the client in a private room, encourage frequent hand hygiene for the client and all visitors, monitor temperature every 4 hours, avoid invasive procedures, e.g., injections, catheterization, when possible. This question focuses on critical infection prevention strategies for a client with chemotherapy-induced neutropenia. The clues are chemotherapy and neutropenia. Placing the client in a private room and emphasizing rigorous hand hygiene for everyone protect against pathogen exposure. Frequent temperature monitoring detects early signs of infection, and avoiding invasive procedures minimizes potential entry points for bacteria. For example, a client with neutropenia who develops even a slight fever needs immediate evaluation and treatment due to their high infection risk. Remember that prophylactic antibiotics are typically not used to prevent resistance, and fresh produce may carry bacteria, which should be avoided. Question 34. The nurse is assessing a client with deep vein thrombosis, DVT, in their left leg. Which findings would the nurse expect to note? Select all that apply. A. Warmth over the affected area. B. Unilateral swelling of the left leg. C. Pallor of the affected extremity. D. Pain or tenderness in the left calf. E. Positive Holman's sign. F. Diminished pulses in the left foot. Answer. Warmth over the affected area, unilateral swelling of the left leg, pain or tenderness in the left calf. This question assesses the nurse's ability to identify the classic signs of deep vein thrombosis, DVT. The keyword is deep vein thrombosis, DVT. DVT typically presents with localized signs of inflammation due to the clot, warmth, unilateral swelling, and pain or tenderness in the affected extremity. commonly the calf. For example, a client complaining that one calf is significantly larger and more painful than the other, and feels warm to the touch, is showing classic DVT symptoms. While a positive Holman's sign, pain on dorsiflexion of the foot, was historically used, it is unreliable and not recommended due to risk of dislodging the clot. Pulses are typically normal as arterial flow is not usually affected. Question 35. A nurse is providing care for a client with a severe exacerbation of ulcerative colitis. Which interventions are appropriate for this client? Select all that apply. A. Maintain NPO status and administer 4 fluids. B. Administer prescribed corticosteroids. C. Monitor for signs of toxic megacolon. D. Encourage a high-fiber, high-residue diet. E. Provide frequent perineal care. F. Monitor hemoglobin and hematocrit levels. Answer. Maintain NPO status and administer 4 fluids, administer prescribed corticosteroids, monitor for signs of toxic megacolon, provide frequent perineal care, monitor hemoglobin and hematocrit levels. This question addresses appropriate nursing interventions for a client with a severe exacerbation of ulcerative colitis. The clue is severe exacerbation of ulcerative colitis. Resting the bowel, NPO status with 4 fluids, reduces inflammation, and corticosteroids are often used to suppress the immune response. Monitoring for toxic megacolon, a life-threatening complication, is crucial. Frequent perineal care is essential due to constant diarrhea, and monitoring hemoglobin/hematocrit helps detect bleeding and anemia. For instance, a client who reports continuous, bloody diarrhea will benefit from perineal care to prevent skin breakdown and frequent monitoring for anemia. Remember that managing inflammation, preventing complications, and supporting hydration are key. Question 36. A nurse is teaching a client about fall prevention in the home environment. Which instructions should the nurse include? Select all that apply. A. Ensure adequate lighting in all rooms and hallways. B. Keep electrical cords and throw rugs secure or removed. C. Place grab bars in the bathroom near the toilet and shower. D. Always use a step stool for reaching high shelves. E. Wear loose-fitting clothes to move freely. F. Have regular vision and hearing checks. Answer. Ensure adequate lighting in all rooms and hallways, keep electrical cords and throw rugs secure or removed, place grab bars in the bathroom near the toilet and shower, have regular vision and hearing checks. This question assesses the nurse's knowledge of effective fall prevention strategies in the home. The keyword is fall prevention. Adequate lighting, securing or removing tripping hazards like cords and rugs, installing grab bars in the bathroom, and maintaining good vision and hearing all significantly reduce fall risks. For example, ensuring hallways are well lit at night can prevent missteps when walking to the bathroom. Wearing loose-fitting clothing can actually increase the risk of tripping. Question 37. A nurse is assessing a client with hyperthyroidism. Which clinical manifestations would the nurse expect to find? Select all that apply. A. Weight gain. B. Heat intolerance. C. Bradycardia. D. Exophthalmos. E. Tremors. F. Constipation. Answer. Heat intolerance, exophthalmos, tremors. This question tests the nurse's ability to recognize the signs and symptoms of hyperthyroidism. The keyword is hyperthyroidism. Hyperthyroidism, an overactive thyroid, speeds up metabolism, leading to heat intolerance, fine tremors, and sometimes exophthalmos, bulging eyes, in Graves' disease. Weight loss and tachycardia are also common. For example, a client who reports feeling constantly hot, has noticeable hand tremors, and finds their eyes protruding is likely experiencing hyperthyroidism. Always remember that these symptoms reflect an elevated metabolic state. Question 38. A client is prescribed furosemide. Which parameters should the nurse monitor regularly? Select all that apply. A. Blood pressure. B. Potassium levels. C. Sodium levels. D. Blood glucose levels. E. Daily weight. F. Intake and output. Answer: blood pressure, potassium levels, sodium levels, daily weight, intake and output. This question assesses the critical nursing monitoring for a client prescribed furosemide. The keyword is furosemide. Furosemide is a potent loop diuretic, so monitoring blood pressure for hypotension, potassium and sodium levels for electrolyte imbalances, daily weight for fluid status changes, and intake and output for diuretic effectiveness are all essential. For example, a client taking furosemide who reports dizziness and has a blood pressure of 90/50 mmHg may be experiencing excessive fluid loss. Regular monitoring prevents adverse effects and ensures therapeutic effectiveness. Question 39. A nurse is caring for a client with a chest tube connected to a drainage system. Which findings require immediate nursing intervention? Select all that apply. A. Continuous bubbling in the water seal chamber. B. Fluctuation, tidling, in the water seal chamber. C. New onset of subcutaneous emphysema around the insertion site. D. Drainage system is below the level of the client's chest. E. Client develops sudden shortness of breath. F. Bright red drainage increases from 50 milliliters to 150 milliliters in 1 hour. Answer: continuous bubbling in the water seal chamber, new onset of subcutaneous emphysema around the insertion site, client develops sudden shortness of breath, bright red drainage increases from 50 milliliters to 150 milliliters in 1 hour. This question addresses critical complications requiring immediate intervention for a client with a chest tube. The clues are chest tube and immediate nursing intervention. Continuous bubbling in the water seal chamber indicates an air leak, which needs investigation. New subcutaneous emphysema, sudden shortness of breath, and a rapid increase in bright red drainage, indicating hemorrhage, are all serious and require immediate attention. For example, if a client suddenly becomes very short of breath and the nurse notices air crackling under the skin around the chest tube site, it indicates worsening pneumothorax or air leak. Tidling is a normal finding. Question 40. A nurse is preparing to administer intravenous fluids to an older adult client. Which considerations are crucial for this client population? Select all that apply. A. Use a larger gauge catheter for quicker infusion. B. Assess for signs of fluid volume overload frequently. C. Monitor skin turgor over the sternum or forehead. D. Maintain strict intake and output records. E. Use an infusion pump to control flow rate accurately. F. Assess renal function before and during fluid administration. Answer: assess for signs of fluid volume overload frequently, monitor skin turgor over the sternum or forehead, maintain strict intake and output records, use an infusion pump to control flow rate accurately, assess renal function before and during fluid administration. This question addresses critical considerations when administering intravenous fluids to older adult clients. The clue is older adult client. Older adults are more susceptible to fluid volume overload due to decreased renal and cardiac reserve, so frequent assessment for signs like crackles and strict intake/output are vital. Skin turgor is best assessed over the sternum or forehead in older adults, as other areas may show decreased elasticity due to age, not dehydration. Accurate flow rate control with an infusion pump is essential to prevent rapid fluid shifts, and assessing renal function ensures proper excretion. For example, an older client receiving 4 fluids might develop crackles in their lungs quickly if the infusion rate is too fast. Remember that older adults have a reduced ability to compensate for fluid changes. Question 41. A nurse is performing wound care for a client with a pressure injury. Which actions demonstrate appropriate technique? Select all that apply. A. Clean the wound with povidone iodine solution. B. Perform hand hygiene before and after wound care. C. Use sterile gloves for applying dressings to a clean wound. D. Document the wound size, appearance, and drainage. E. Turn the client every 4 hours to relieve pressure. F. Educate the client about the importance of nutrition for wound healing. Answer. Perform hand hygiene before and after wound care. Use sterile gloves for applying dressings to a clean wound. Document the wound size, appearance, and drainage. Educate the client about the importance of nutrition for wound healing. This question tests the nurse's knowledge of proper wound care for a pressure injury. The keyword is pressure injury. Essential actions include meticulous hand hygiene, using sterile gloves for clean wound dressing application to prevent infection, thorough documentation of the wound's status to track healing, and educating the client on the importance of protein and vitamin C for tissue repair. For example, observing and documenting that a wound has less drainage and is smaller in size indicates healing progress. Cleaning with povidone iodine is typically avoided as it can be cytotoxic to healthy tissue, and turning every 2 hours is standard to relieve pressure, not 4. Question 42. A nurse is assessing a client with a suspected opioid overdose. Which clinical manifestations would the nurse anticipate? Select all that apply. A. Pinpoint pupils. B. Hypertension. C. Bradypnea. D. Tachycardia. E. Hypothermia. F. Increased level of consciousness. Answer. Pinpoint pupils, bradypnea, hypothermia. This question assesses the nurse's ability to identify the classic signs of opioid overdose. The keyword is opioid overdose. Opioids typically cause central nervous system depression, leading to pinpoint, myotocy, pupils, significantly decreased respiratory rate, bradypnea, and hypothermia due to vasodilation and reduced metabolic rate. For example, a client found unresponsive, breathing very slowly, with tiny pupils, needs immediate administration of an opioid antagonist like naloxone. Recognizing these signs is crucial for timely intervention to prevent respiratory arrest. Question 43. A nurse is caring for a client with acute pancreatitis. Which nursing interventions are appropriate for this client? Select all that apply. A. Maintain NPO status and administer 4 fluids. B. Administer opioid analgesics for pain management. C. Monitor blood glucose levels. D. Place the client in a high Fowler's position. E. Encourage a high-fat diet to aid digestion. F. Assess for signs of hypocalcemia. Answer. Maintain NPO status and administer 4 fluids. Administer opioid analgesics for pain management. Monitor blood glucose levels. Assess for signs of hypocalcemia. This question addresses appropriate nursing interventions for a client with acute pancreatitis. The clue is acute pancreatitis. Resting the pancreas, NPO with 4 fluids for hydration, is crucial. Pain is severe, requiring potent analgesics like opioids. The damaged pancreas can affect insulin production, necessitating blood glucose monitoring. Pancreatic enzymes can cause fat saponification, leading to hypocalcemia, which requires monitoring. For example, a client with severe abdominal pain and nausea might have their pain effectively managed with 4 opioids while receiving 4 fluids to support hydration. Positioning the client for comfort may involve leaning forward, not necessarily high Fowlers. Question 44. The nurse is assessing a client for a potential pulmonary embolism, PE. Which clinical manifestations would the nurse expect to find? Select all that apply. A. Sudden onset of dyspnea. B. Chest pain, often pleurisy. C. Bradycardia. D. Tachypnea. E. Hemoptysis. F. Hypotension. Answer. Sudden onset of dyspnea, chest pain, often pleurisy, tachypnea, hemoptysis, hypotension. This question tests the nurse's ability to recognize the signs and symptoms of a pulmonary embolism, PE. The clue is pulmonary embolism, PE. PE often presents with a sudden onset of dyspnea, shortness of breath, pleuritic chest pain, sharp pain with breathing, rapid breathing, tachypnea, and sometimes hemoptysis, coughing up blood. Large PEs can lead to decreased cardiac output and hypotension. For instance, a client who suddenly gasps for air, clutches their chest in pain, and has a very rapid respiratory rate requires immediate medical evaluation for a PE. Prompt recognition and treatment are vital to prevent severe complications. Question 45. A nurse is providing discharge teaching for a client who underwent a cataract extraction. Which instructions should the nurse include? Select all that apply. A. Avoid bending at the waist or lifting heavy objects. B. You can rub your eyes if they feel itchy. C. Wear an eye shield at night for the first week. D. Avoid straining during bowel movements. E. Report any sudden decrease in vision or increased eye pain. F. It's normal to have some drainage or crusting around your eye. Answer. Avoid bending at the waist or lifting heavy objects. Wear an eye shield at night for the first week. Avoid straining during bowel movements. Report any sudden decrease in vision or increased eye pain. This question addresses essential discharge instructions for a client following cataract extraction. The clue is cataract extraction. To prevent increased intraocular pressure and protect the healing eye, clients should avoid activities like bending, lifting, and straining during bowel movements. Wearing an eye shield, especially at night, protects the eye from accidental injury. It is also crucial to report warning signs such as sudden vision decrease or increased pain, which could indicate complications. For example, telling a client to use a stool softener to prevent constipation can help them avoid straining. Remember that protecting the eye and monitoring for complications are paramount during the recovery period. Question 46. A nurse is assessing a client with severe depression. Which clinical manifestations would the nurse expect to find? Select all that apply. A. Increased energy levels. B. Anhedonia, loss of in activities. C. Significant weight gain or loss. D. Insomnia or hypersomnia. E. Elevated mood. F. Impaired concentration. Answer. Anhedonia, loss of pleasure in activities, significant weight gain or loss, insomnia or hypersomnia, impaired concentration. This question tests the nurse's ability to recognize the core symptoms of severe depression. The keyword is severe depression. Depression is characterized by a pervasive low mood, anhedonia, inability to experience pleasure, significant changes in appetite leading to weight fluctuations, sleep disturbances, either too little or too much, and difficulty concentrating. For example, a client who reports no longer enjoying hobbies they once loved, sleeping for only a few hours a night, and forgetting things easily is showing signs of depression. Recognizing these symptoms is the first step towards seeking appropriate mental health care. Question 47. A nurse is caring for a client with a spinal cord injury at the T6 level who is experiencing autonomic dysreflexia. Which nursing interventions are appropriate? Select all that apply. A. Place the client in a supine position. B. Loosen tight clothing or binders. C. Palpate the bladder for distension. D. Administer an antihypertensive medication. E. Encourage the client to bear down. F. Elevate the head of the bed to 90 degrees. Answer. Loosen tight clothing or binders, palpate the bladder for distension, administer an antihypertensive medication, elevate the head of the bed to 90 degrees. This question addresses the critical nursing interventions for autonomic dysreflexia in a client with a spinal cord injury at T6 or above. The clue is autonomic dysreflexia. The immediate priority is to identify and remove the noxious stimulus. Elevating the head of the bed to 90 degrees helps lower blood pressure. Loosening tight clothing and checking for bladder distension or a kinked catheter are crucial initial steps. If blood pressure remains dangerously high, an antihypertensive medication may be needed. For example, if a client with a T6 injury suddenly becomes flushed and complains of a pounding headache, the nurse should immediately raise their head and check their bladder for fullness. Bearing down can worsen the hypertensive crisis. Question 48. A client is diagnosed with acute glomerulonephritis. Which clinical manifestations would the nurse expect to find during the assessment? Select all that apply. A. Periorbital edema. B. Hypertension. C. Cola-colored urine. D. Polyuria. E. Proteinuria. F. Hypoalbuminemia. Answer. Periorbital edema, hypertension, cola-colored urine, proteinuria. This question assesses the nurse's knowledge of the typical clinical manifestations of acute glomerulonephritis. The clue is acute glomerulonephritis. Inflammation of the glomeruli impairs kidney function, leading to fluid retention and hypertension. Periorbital edema, swelling around the eyes, is common. The damaged glomeruli allow red blood cells and protein to leak into the urine, causing cola-colored urine, gross hematuria, and proteinuria. For example, a child who wakes up with puffy eyes, has dark brown urine, and an elevated blood pressure might be experiencing acute glomerulonephritis. Oliguria, decreased urine output, not polyuria, is typical. Question 49. A nurse is caring for a client with end-stage liver disease. Which findings would the nurse expect during an assessment? Select all that apply. A. Jaundice. B. Ascites. C. Phader hepaticus, breath odor. D. Bradypnea. E. Asterixis, flapping tremors. F. Hyperglycemia. Answer. Jaundice, ascites, Phader hepaticus, breath odor, asterixis, flapping tremors. This question addresses the expected clinical manifestations in a client with end-stage liver disease. The clue is end-stage liver disease. The liver's inability to metabolize bilirubin causes jaundice. Portal hypertension leads to fluid accumulation in the abdomen, ascites. Impaired detoxification results in accumulation of toxins, causing characteristic breath odor, fader hepaticus, and neurological signs like hysterexis, flapping tremors, due to hepatic encephalopathy. For example, a client with yellow skin and eyes, a distended abdomen, and a peculiar sweet musty breath odor is showing classic signs of liver failure. Hypoglycemia, not hyperglycemia, can occur due to impaired glucose regulation. Question 50. A nurse is providing education to a client with osteoporosis. Which interventions should the nurse include to help manage the condition? Select all that apply. A. Engage in weight-bearing exercises regularly. B. Increase intake of calcium and vitamin D. C. Avoid smoking and excessive alcohol consumption. D. Participate in high-impact activities for bone strength. E. Take prescribed bisphosphonates as directed. E. Implement fall prevention strategies at home. Answer. Engage in weight-bearing exercises regularly, increase intake of calcium and vitamin D, avoid smoking and excessive alcohol consumption, take prescribed bisphosphonates as directed, implement fall prevention strategies at home. This question addresses comprehensive management strategies for a client with osteoporosis. The keyword is osteoporosis. Weight-bearing exercises, e.g., walking, help strengthen bones, and adequate intake of calcium and vitamin D is essential for bone health. Avoiding smoking and excessive alcohol reduces bone loss. Bisphosphonates are a common medication to slow bone breakdown. Implementing fall prevention strategies is crucial to prevent fractures, which are a major complication of osteoporosis. For example, suggesting daily walks and ensuring a client's diet includes dairy products or fortified foods helps support bone density. High-impact activities might be too risky for those with fragile bones.